Hi, this is Divya Prakash. Periodic evaluation and updating of certain calibrations such as normalization and well counter corrections are very important component for a routine PET quality control. Here in this presentation we shall be discussing about what is normalization and WCC, how to do it in GE Discovery IQ machine with tools required, how to generate final correction matrix and verify it, and finally what is the effect on an image quality from this whole exercise. Since procedures are different for different machines, so our talk will be limited to GE Discovery IQ PET-CT machine only. So let's begin. Let's discuss what is normalization in PET-CT. Normalization is basically correction for non-linearity and non-uniformity, which is similar to those that are employed in SPECT machines. A PET scanner may have 10,000 to 20,000 individual detector elements which may have small variations in dimensions or in fraction of scintillation light that is coupled to the PMTs. There may also be difference in effective thickness of crystal seen by photons traveling along different angles of incidence for different cross planes. Correction for these variations is known as normalization. It involves the measurement of differences in individual crystal efficiencies to obtain correction factors which are applied on each emission scan. Now let's see WCC, that is well counter correction. It converts PET true counts, that is CPS, means counts per second of activity, into activity concentration, that is kilobecquerels per ml, and it is required to calculate SUVs, means standard uptake values. It uses low scatter and dead time conditions where a water-filled flood phantom with a small and known quantity of radioisotope is used to correlate the measured numerical value in each image pixel to a specific activity, that is activity per volume. It also maintains a good match of sensitivity between imaging system and a dose calibrator. Now let's see what all the tools are required. First is DQA annulus phantom, flood phantom and phantom holder assembly, 20 megabecquerels of 18F radioactivity, and of course GE Discovery PET-CT machine. Before starting any procedure, we should take backup of all protocols, procedures. So let's do that first. Click service icon. It defaults open in a CT. Go to utilities. Click system state USB. Select all. Insert USB drive and click save. When message appears, completed successfully, remove USB. With this, our backup is completed. So let's start with the normalization procedure. Click ExamRx icon on the right monitor. Click new patient on left monitor. Type PET WCC 3D in capital into the patient's name and patient ID data fields. Then click PET tracer info and record information from the phantom label, that is phantom volume. Generally phantom volume is written on the phantom, but when it is not written, you can enter 1250 ml. Enter date and total activity which is mentioned on the phantom, and do not update injection time and post injection as a data fields. Click accept and close the tracer panel. Now click G tab on protocol selector. When looking at the anatomical adults, place the cursor directly under the toes and the miscellaneous protocol selection should display. Click the normalization 68G annulus protocol. Do not change any default parameters. Mount and position DQA annulus phantom on machine holder. Align scribe mark on phantom to the external lasers and press external add mark. The phantom should be centered in the longitudinal direction. Make sure all personnel leave the scan room and then initiate the scan sequence. Click confirm for scout scan sequence. Press move to scan and start scan button when it flashes. Click next series. Use graphic RX localizer to position the scan field over the center gray area of the phantom away from the phantom edge. Click confirm. Press move to scan and start scan when it flashes. The system acquires CTAC. Click PET and then confirm. The default acquisition time on normalization menu is listed as 2 hours 30 minutes and it is a worst case value. The actual acquisition time is based on the activity of the annulus phantom with the stop on count selection turned on and can be as short as 8 minutes with a new phantom. Acquisition time, however, will increase as the phantom ages. Press move to scan and start scan when it flashes. Wait for scan to complete. Prospective reconstruction begins immediately on scan completion. Click ending job. Do not delete or modify the image series created in this test until the next normalization scan. Remove annulus phantom and store it in a shielded container. Remove phantom holder from the table cradle. Now let's do well counter corrections. The WCC calibration matches a known quantity of activity concentration to the display image pixel value, that is total activity minus residual activity divided by flood phantom value is equal to millibecquerels per ml in flood phantom. We should make sure all the clocks are synchronized. A time difference of only 2 minutes introduces a bias of more than 1% for F18 FTG. Fill water and approximately 20 MBq of F18 in flood phantom and mix thoroughly. Record the times and activity value of pre-syringe and post-syringe. Tilt and rotate the phantom to dislodge all air bubbles. All air bubbles with a diameter less than 10 mm will not disturb most tests. Mount and position flood phantom in flood phantom assembly. Align the scribe mark on the phantom to the external ledgers and press external landmark. The phantom should be centered in the longitudinal direction. Click ExamRx icon on the right monitor. Click New Patient on the left monitor. Enter PET WCC 3D into the patient name and patient ID fields. Enter PET tracer info. The phantom volume default is 5640 ml. Enter that volume. And pre-injection post-injection assay and fill the time and activity into pre-injection and post-injection assay fields. Click accept and close the tracer window. Go to the G tab on the protocol selector. When looking at the anatomic ladle, place the cursor directly under the toes and click. The miscellaneous protocol will open. Click WCC flood protocol now. Do not change the default parameters. Make sure all personnel leave the scan room before you initiate the scan sequence. Click confirm and initiate the scan sequence. Press move to scan and then start a scan button when it flashes. Click next series. Use the graphic RX localizers to position the scan field over the center gray area of the phantom with the red cross hair centered on the phantom. Click confirm. Press move to scan and then start a scan when it flashes. The system acquires the CTAC and generates the 3D normalization data. Click PET and confirm. Press move to scan and start a scan when it flashes. When the system displays the message scan completed, click end exam. This is the image obtained from flood phantom. Now generating the 3D normalization and well counter corrections. Click the service icon on the right monitor. Click PET radio button now. The default opens with the CT. So we need to click PET radio button to display PET service desktop. Click image quality icon. Click the 3D normalization folder to display its contents. Click 3D WCC calculation to open 3D sensitivity and activity correction image set window. Select the image set from the most recent WCC acquisition with description 3D WCC flood phantom. Select the image set from the most recent WCC acquisition with description 3D WCC FTG flood. Click OK to display a sensitivity and activity correction generation graph. Click accept to set the newly generated well counter as the system default and open a WCC description window with the default description displayed. Click save to open an alert window with the message WCC results stored in database. Click OK to use this as default correction for all scans. Now as a last step of verification, return to PET service desktop image quality tab. Click Cal Manager now to open the PET calibration database. Click the well counter calibration and normalization checkboxes to display the corresponding database information. Verify the most recently acquired normalization and 3D WCC appear in the database with the label true in the default column. Click close to exit the PET calibration database manager. Remove flood phantom from table cradle. With this, whole procedure of normalization and well counter corrections is completed. Now see the effect of normalization and well counter corrections in the image quality. These two images are before normalization in WCC and these two images are after this. This line was appearing near vertebra which is gone after the calibration and whole image quality has improved significantly. Visit www.nuclearmedicinesolutions.in for further information. If you like this channel, Kindly subscribe and share among your friends. Please feel free to write us at support@nuclearmedicinesolutions.in for any query and feedback. Also suggest other topics to be addressed of your choice.